I just had a vampire facelift. Can I get fillers 3 days afterwards in my cheeks?
Thank you for your question. You submitted your question without a photo. You state in your question that you had a vampire facelift 3 days prior, or that you want to know if you can get filler after undergoing vampire facelift 3 days after having this procedure. Well, I can certainly share with you a perspective without the benefit of an image or more details. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been a resource for the Vampire Facelift Network in terms of media who often reach out at times when they want clarification, periodically when the Vampire Facelift gets press. And so certainly I have been available to help people understand what the Vampire Facelift is, and this can be useful for your question about having placement in the cheeks. So to begin with, just for the sake of clarification, I think we have to first, of course, define what a vampire facelift is. If you had a vampire facelift performed by a vampire facelift provider, then you had a combination of platelet-rich plasma derived from your blood, which is a concentration of the wound healing factors that help stimulate the skin in a way that makes the skin look healthier, and that's injected under the skin in different places strategically, as well as the use of a hyaluronic acid filler, but one syringe or 1 cc placed strategically, and I would say typically it's just below the skin level. So if you're asking about the cheeks, I would say that one major variable to be aware of, and that variable is how swollen are you 3 days after the procedure. A majority of time with this type of vampire facelift procedure, there isn't a lot of swelling. And a lot of times people like this procedure because of the strategic approach that allows patients to do this and go back to work the next day. So if there isn't significant swelling, we have to then ask, what do you want to do in terms of the cheeks? When you think of the cheeks, I'll tell you how I approach this. Typically, when someone wants cheek volume, it is reflective of underlying structural either deficit that's genetic or loss related to facial aging. What I do is something called structural volumizing. Structural volumizing means placement of a longer-lasting filler, whether it's a Juvederm Ultra Plus or Juvederm Voluma, and placing it under the muscles, above the bones, using a very minimally traumatic technique with blunt cannulas. By doing that, we're actually treating an area that is not likely to have been treated with the vampire facelift procedure. So the point is that these compartments and spaces can be technically addressed because of the separation. If you were to try to add volume in an area where filler was placed already, then predictability and accuracy in correction can be problematic if there's still some swelling. And so generally speaking, we see our patients 2 weeks after any filler treatment to look at how things look when things have equilibrated or settled down. So if your physician did not do structural volumizing at the time, then it is probably likely that it's completely safe to do that using that strategy. That being said, I would generally dissuade patients from doing anything so close unless we're really looking at separate areas. For example, if someone had their under eye filler placed and they want to do something for their chin and jawline, well then 3 days later is perfectly fine. These are separate anatomic areas. But if we're looking at overlapping areas, then usually waiting is better. A lot of times patients will have urgent deadlines. So they may come in 3 days later because they have a big event a week from now, or they have something they want to look good for and they're not going to be around because they're traveling. So we always have to look at the individual situation. So the take-home message here is essentially if the area that you want to treat is not at all affected significantly by the vampire facelift procedure, then you can probably with reasonable accuracy have a correction done, an improvement, and maximize the outcome of your appearance. So I hope that was helpful. I wish you the best of luck. Thank you for your question.